None of us need another thing to worry about. But the truth is, we have to talk about monkeypox. There's plenty you should know. So first, cases are on the rise in the U.S. Nearly 3,000 people have it, and that number includes at least 2 children. New York has the most cases by far. Second, there is a vaccine, but there's not enough to go around. I spoke with White House Chief of Staff Ron Klain about that, and here's what he had to say.
We take this very seriously, and we know that particularly for the communities that have been most affected, they need us to get this vaccine where it needs to get to as quickly as possible. That's what we're working on. We want to try to contain the spread of monkeypox and try to make sure this does not become an endemic virus in the United States.
Third, the World Health Organization declared monkeypox a global emergency. This is after weeks of medical workers asking for resources to fight it. Now, people are asking, what took them so long? Let's talk about that with my next guest. Dr. Uche Blackstock is an MSNBC medical contributor, as well as founder and CEO of Advancing Health Equity. Welcome, welcome, doctor. Okay, you are one of the people not too pleased with the World Health Organization, as evidenced in this tweet of yours. This is what you write. You said, wait, so experts have been raising the alarm about monkeypox for years due to outbreaks in Central and West Africa, and their warnings went unheeded. But now Europeans and USians are being infected, so finally resources are being mobilized and funding redirected. Got it. Doctor, you make an important point there. So do you think if people cared more about this disease when the outbreak was on the continent of Africa, could we have prevented this from becoming a global emergency?
Simone, thank you so much for having me. And that is such an important question. And I think Ronald Klain's response kind of answered that. He said that he doesn't want monkeypox to become endemic in the United States. But it was endemic in Central and Western Africa, and then it wasn't an issue. We know that monkeypox has been around since 1958. The first case was in 1970. There have been outbreaks, most recently in the Democratic Republic of Congo and in Nigeria, on and off for the last several decades. And those areas had asked for international support with respect to vaccination and therapeutics in the past, and they did not get it. But now we're seeing cases rise in the UK, other parts of Europe, and here in the United States, with New York City being the epicenter. And now, Dr. Tedros, I think appropriately so, issued that global public health emergency declaration, which will hopefully bring a coordinated international response to this problem.
So let's talk about what not just the White House, but the administration is now saying. We have Health and Human Services Secretary Xavier Becerra saying that now in the United States, we have more than 300,000 vaccines available for distribution. How would you grade the U.S.'s response to monkeypox thus far?
So I would say close to an F. This is what I'm saying. I'm saying we haven't learned anything.
I want to make sure I heard you. Close to an F. That's a low grade, Doc. Tell me why.
Well, we haven't. It's as if we haven't learned anything from COVID from the last 2.5 years. Like, we were supposed to be prepared for this, and that stockpile of vaccinations and medications that we did have were in case of a bioterrorism event. It wasn't in case there was, an outbreak like we're seeing here right now. Okay, and so what we've seen so far, and especially here in New York City, we've seen a very, very slow rollout of vaccinations, people having such a hard time getting vaccinations, even signing up. So even those processes are not in place to get access to vaccines. Also, even the therapeutics are also in short supply. And then also, we haven't seen that much public health messaging about it. People need to know what symptoms to look out for, when to seek help. And I think even, a broad public health messaging campaign would be incredibly useful in a time like this. So my standards are high because of everything that we've been through over the last 2.5 years with COVID. We should know better by now, and I'm not clearly seeing that. Again, we're behind the 8 ball.
All right, that's the grade from the good doctor. You talked about public health messaging, and as I have been looking at this, reading about it along with everyone else, seeing people I know go and get vaccinated against monkeypox, I've been hearing a lot about these different stigmas that have been associated with this virus. And one of them in particular involves the community most affected so far. You know, most of the people who have contracted the virus are men who have sex with men. But I think back about how this was the same group that was targeted when HIV started to spread. AIDS, it was ignored. It was called, it was called the gay cancer until people realized anyone could get it. So can you talk a little bit and maybe dispel this misinformation and other lies about how monkeypox is being spread?
Right. So I think what's really important, though, is to explain to the public why are we seeing these outbreaks in the community of men who have sex with men. And the reason why is because there's close skin-to-skin contact due to sexual networks and social networks in a lot of rave parties that are happening, okay? So to be transparent about why that's happening, but then also to say, okay, this is how we can reduce outbreaks. Maybe, and the New York City Department of Health has said this, reduce the number of sexual partners that you have right now. Or, for example, maybe reduce the number of these parties that you go to, reduce opportunities for exposure. But I think also the messaging should be that anyone can get this, because this does happen from skin-to-skin contact. It does happen due to touching contaminated surfaces. It does happen if you have exposure to respiratory secretions of an infected person. As we saw with those 2 children who've been infected, we think that's household transmission. And the fact is that all of our communities are interconnected. So even though we're seeing it mostly among men who have sex with men, we know that it's a virus that can impact anyone. And so that's why it's so important that really everyone be educated about this virus, and that we also do not stigmatize the gay community, transgender community, non-binary community, as we try to educate the public about what's happening.
Dr. Uche Blackstock, thank you very much.